Good afternoon, ladies and gentlemen. I'd like to thank Lohmann Rausch and Activa for inviting me to present to you this afternoon. And as Andrew said, I'm going to talk about the patient perspective. When I looked at this, I looked at debridement across all age groups because we tend to focus on the chronic and the elderly population. But if you think about debridement, that's relevant to every patient at every stage in their life if they've got a problem with their wounds. So it's not just an elderly thing, it's across all age groups. And I thought about what is important to me and the people that I work with in clinical practice when we're looking at debridement. And I came up with these three subjects here: effectiveness, control and empowerment. I want to take you through those on a one-by-one basis now. Effectiveness, and I think it's remarkable, Andrew, that the commissioners and the providers are talking from the same hymn sheets. That was really lovely to hear, that we're reflecting each other in our needs. That was super. Timely is very important, and I'll look at this in the next slide in a moment. But we need to get rid of that non-viable tissue very quickly and at the right moment in time. And in the past, I've been very guilty of carrying on debriding 2, 3, 4 weeks, thinking I was being active in my debridement, but actually was never achieving anything from a patient in a timely fashion. So speed is really important. It's got to be available to me, and you can see the processes that Andrew's outlined in the UK to make sure that I can have the debridement methods that I need. But I know a lot of you here are not from the UK, but if you do go to the Lohmann Rausch booth after this presentation, you'll be made aware of how you can access Debridement in all the different countries throughout Europe. We need to get rid of the biofilms, and I think that the concept that Greg has said about biofilm-related wound care definitely is becoming to the forefront here. We've moved to the next stage now, and we do need something that can debride the non-viable tissue, but take those biofilms as well. And seeing Dot remove those biofilms, that is absolutely marvellous, because it gives me the scientific understanding of what I'm seeing in my own clinical practice. So that really was very, very supportive. And I don't know about yourselves, when we talk about visible outcome, I do sit in lots of symposium, I sit in lots of presentations, and I don't know, sometimes I look at the before pictures and I look at the after pictures, and I can't really see a difference. And yeah, I'm not alone. And in clinical practice for patients, we need to see a difference. If they're going to believe that what we're going to do is going to help them, they've got to see a visible outcome in a timely fashion. And to me, that's very important. Because to get them to concord with us, they've got to see those benefits very, very early on. And Andrew has mentioned the supportive guidance is available to us on Debridement from NICE. For the nurses in the UK, I looked at our code of practice for nurses, and look what it says in here. It talks about timeliness, it talks about speed, and it talks about activity, not this apathy of continued care without achieving something. So even within our own code of nursing, it talks about working without too much delay to make sure we achieve the best outcomes of the patient as quickly as possible. Control. And I like that, Andrew. I think that's going to be the next Lohmann Rausch or Activa, the grab-and-go debridement product. I like that very much. I think it's a new strapline there. It is a very simple technique. It can be done anywhere, and it does not require any specialist equipment. It can be disposed of as clinical waste. But the bottom line there, that's the one that's really important to me. Because I do undertake sharp debridement in my clinical practice. I've been on the course in Bradford, an excellent course that taught me how to sharp debride. But you look at a patient's eyes when you're walking towards them with metal forceps, scalpels, they don't welcome that approach. I think it really does induce a lot of anxiety in patients. Whether it's me that induces that or the instruments, I'm not sure. But it's important that we do not cause any harm. I'm making light of a very serious subject. And I just want you to have a look at this next slide here. And this is work done by Hemmerle in 2011. Because when mechanical debridement was being reintroduced, as Andrew said, it came back to us. I was very cautious. But when I read this work, it's important that you can see here the small islands of epithelium were left intact following use of Debridement. So this is where the research gave me the confidence in my clinical practice to know that I would do no harm to patients when I brought mechanical debridement back into my portfolio of debridement methods. We talked about people using debridement, and I'll talk about patients in a moment. But here you can see this is Tanya McIntyre, who's a lymphedema assistant in Portadown. And this is an untrained nurse using Debridement as part of the debridement practice. So that re-emphasises that the skills can be there for all people in the healthcare settings. It's not just the highly skilled individuals. And as you can see, Rosie Callahan agrees with me on that. Empowerment. Now, this is really important, and I think this is where Debridement has got a great advantage over a lot of other methods of debridement. Because when I'm talking to patients about debridement, I talk about the different methods. I give them the option. These are what I've got available to you. These are the advantages, the disadvantages, the limitations. What method of debridement would you choose? And we have this discussion between us. And this is where I think Debridement really comes to the fore. Because quite often when I've gone through the gambit with them, the choice they make is one that is simple, quick, timely, and if need be, they can do themselves. And I use some clinical case studies to emphasise that in a moment. It can be used in combination with other techniques. It's not a one-stop shop. So again, that's fine. If we need different techniques at different moments in time in the debridement for the patient, that's absolutely fine. It's finding where each method fits in that process. But the fact that the patients can use it themselves is really, really important, because that goes back to empowerment and control when they're in control of the decision, but also the actual method that's being used. And again, you can see there our nursing code says we should listen to our patients, which is what we need to do. So let's have a look at some case studies here, and I'm very grateful to my clinical colleagues who shared these with me and let me use them in my presentation. So these were all used with permission, the photographs from the clinicians and from the patients and relatives. And this is Jackie Denier, who is, I'd say, the most experienced EB nurse in the UK. And you can see there was a build-up of powders on this neonate, on this child with EB. And these powders were used to stop bleeding. So it wasn't the fact they couldn't use the powders, they had to use them to stop the bleeding in the child. But the way the parents were removing this was with solutions and with gauze, and it was causing great pain. And a neonatal pain scale was used, and it was up at 6. It was very high pain with the current methods. So Jackie showed them Debridement. She showed them how gentle the pad was, how delicate the pad was. The patients then used this themselves, and you can see here we've got all that completely removed, and the pain scale for this child just plummeted, because this EB that the patient had was not compatible with life normally past the age of 2. So the time the patients had with this child did not want to be causing any pain, wanted to be a good positive experience, and that's what worked for this patient in this situation. This is from a colleague in mainland Europe, from Ingo Stoffels, and this you can see we're moving from the child now to the young person. And this young lad went out on New Year's Eve, and there was a firework display, and that's the firework embedded in his forehead there. And again, this is where that Debridement was used to debride the residue of the firework matter from the person's head. Because you know, if you leave that in place, it's like gravel rash. You can get very nasty tattoos and very nasty cosmetic effect. But it worked really well, as you can see there. This is from Collins and Bethel, colleagues of mine from England. And this then is moving on to the story from a young lady. And again, if you want to go and find more about this story, Stella's story, you can do from the stand downstairs. And this lady used it to debride her own leg. So we talk about giving control to the patient and can the patients do it. And this lady had been in a situation when other things she'd been told would debride her leg also didn't. So she was feeling very low and not feeling there was any hope for her. She used Debridement, and you can see there the really positive results of that. And her story really is worth reading. I would recommend that to you. Then when we move now to the more elderly population, and I think this is a marvellous example, but I also find it damning to nurses in the UK. This is a colleague, Teresa Greaves. And you can see this gentleman's legs and feet. His legs and feet have been like that for 13 years. When we talk about chronicity, Greg, I think 13 years is quite a duration. And again, Teresa was one of the early adopters that Andrew alluded to. She used the Debridement, but here on the hyperkeratosis, where it's just as effective as it is at removing slough from the womb bed. And you can see that after just over 7 weeks, look at the change in this gentleman's legs. And when we're talking about self-esteem, empowerment, and moving forward, I think this is a marvellous example of how it can really change someone's life, their self-esteem and their views about themselves. Because this gentleman had just become quite housebound. He'd seen this going up and up his legs over 13 years and getting no better. And he'd lost all hope. But Teresa brought those legs back. And I wouldn't mind those legs myself, really. I think they're quite impressive. I also have used debridement in different ways. And I've used Debridement in different ways. And I had an e-poster about this earlier on at this conference. And what I've started to do in my own clinical practice is I've used it in combination with emollients. You don't use emollients when you're using Debridement they don't work together, but separately they work as a marvellous combination. But we had an elderly population coming in with very dry skin, and what was happening is the emollients were being put on top of the dry skin, and we weren't getting proper penetration of the emollients. So we started, as a patient came into us, they had dry skin, we removed the dry skin, not as severe as the hyperkeratosis, just dry skin, removed that with the Debridement, then we applied the emollients, and we got a lot better penetration following the Debridement and emollient combination in that way in our patients. Anecdotally, we've reduced the number of skin tears in our patients because their skin integrity is so good, because the emollients have done their job, because their skin was prepared correctly. So though you talked about wound bed preparation, this perhaps takes it to general skincare and preparing the skin well. So in conclusion, you can see there that I think as clinicians, debridement is what we do no matter what the patient's age, across all age ranges of the people that we deal with. But we need to make sure that we give them safe debridement, timely debridement, and have effective patient outcomes. And I would echo that quote there from David Gray on the screen, because I think it shouldn't be limited to my skills. It should be focused around the patient, and Debridement offers that option that hopefully you've seen in my presentation. Thank you.